Medical Minds yet again today. Teacher Zita together with Dr. Andabati in the class, as we always call it. And I'm sure the learners, you've taken your pens, you've taken your books, and ready to listen to our second part of the show, where we're going to look at surrogacy. That is the facts and the myths that we need to air out today. We are talking about surrogacy once again today.
Yes.
And I'm sure we have many viewers who are listening and are watching.
Yes.
Before we go into other points,
yes.
maybe we can review a little bit of our topics. Yes.
Oh,
what
yes.
surrogacy was.
Oh, yes, yes. Okay, yeah. So, surrogacy, this is a very important topic to discuss. Now, surrogacy is a form of treatment arrangement we do for people who have infertility. That is, they're having challenges with conceiving, but it's one of the forms. Now, what happens in surrogacy is that instead of the woman to carry the pregnancy, we ask somebody else to carry the pregnancy. So that is basically it. Okay. So you're doing the treatment, the couple has come, they have infertility, they're having challenges with conceiving, but then for some reason, the woman cannot carry the pregnancy herself. So we get another person, a third person, who is the surrogate mother to carry the pregnancy.
Thank you so much.
So that is basically what surrogacy is about.
Thank you, doctor.
Yeah. Surrogacy arrangement has two parts. There's the part, because for you to do surrogacy, it must be through IVF treatment. So one, you have issues with conceiving naturally, so we first do IVF for you. And that IVF part, the treatment, in our unit costs around 14 to about 19 million, the IVF part alone. Then once that is done, we have to put the baby to grow in the surrogate mother. Now, once the surrogate mother is pregnant and is carrying the pregnancy, the cost depends on what type of arrangement it is. If the surrogate is the one which the hospital gets, that means it is the anonymous one where she doesn't get to see you, you don't get to see her. We usually keep those mothers for all the 9 months. So you have to cater for their living. So you pay a monthly fee, about around 1M to that mother. And then also on the side of the hospital, because we are looking after them, you have to pay the hospital some amount. I think it's about 1M also. So you have to prepare with about 2 to 3 per month until the surrogate mother gives birth. Yes. Then at the time of giving birth, you have to meet the cost of the delivery. Usually not much, but it's through C-section usually, and it will cost you maybe about 3 to 4 million for the C-section. And then you pay this mother a surrogate fee, an agreed amount, usually about 9 or so million. So this is the spread second part of the cost. But the initial one is the IVF. Yes. So if you look at the whole total for the entire thing together, it may look big, but the second part is paid as you go along.
As you go along.
Yeah. So if you have something like about on average about 15 million, you can be able to initiate the surrogate program.
Yes. True.
And if that is hard for you, you can bring your own surrogate mother. Yes.
A friend or...
Yes, somebody. And some
or
people
even a stranger.
Yes. Somebody whom you can trust. We assess them. And if we find them suitable and medically fit, and then we can initiate. And so whatever you negotiate with them will be between you and them.
True.
So
your part is to only do that.
Exactly.
Yes.
We do the technical part.
Yes,
so with us, you will only incur the 15 or 16M. The other one, you negotiate with them.
Thank you.
Yep.
Thank you so much, doctor. For someone watching you there, they are wondering why they should get treated, yet it's another mother who is going to carry the baby. Let's talk briefly about that. Why would you treat me, yet it's someone else going to carry the baby?
Yes. Okay. Yeah, again, that's a very good question. Now, as I said, surrogate program is a part of IVF treatment. Now, the primary thing is you've had issues with conceiving.
Yes,
you're not able to conceive.
Yes.
Now, we need from the mother and the father, we need the eggs from the mother and the sperm from the
father.
From the father.
Okay.
Yes, and then we fertilize the egg with the sperm to create an embryo. Now, it is that embryo which we put in the womb of the surrogate mother to carry. Now, you need to create the embryo. So, because of that, you need to generate the eggs. To generate the
from the mother?
From the mother.
Oh,
so, to generate the eggs, you have to give treatment. So, we give some medication, which we call a stimulation program. Then we remove those eggs. So, all this is treatment on the mother, the real mother.
Okay.
Yeah. Then for the father, mainly it is providing the sperm.
Okay.
Unless if there is some other reason, for example, maybe the sperms are too few or you can't get them in the fluid, you have to extract them by some procedure from the testicles.
Okay.
And so all this is treatment to create an embryo. Okay. And that is what finally you put in the womb.
Thank you.
Of the surrogate.
Thank you so much.
Yeah.
I think maybe you've got all the answers, and because you're wondering why you would get treated, yet it is another mother who is going to carry the baby. As doctor was saying, this helps to, I think, perhaps to get a clear egg so that it can be fertilized with the other sperm from your husband, then it can be transferred.